Welcome to Friday's edition of COVID-19. We are starting with some unsettling numbers today. In about a year since the first confirmed case of the virus in Wuhan, China, the world has lost more than 1.5 million lives to the pandemic. Meanwhile, here in Korea, the daily tally has hit above 600 for the first time in 9 months. Now, having said that, I turn to our Kwon Soo-ah for more on this disturbing event. Now, so I'll just start us off with the latest on the pandemic here in Korea for this Friday.
Yes, Sunny, as you just said, we hit a number above 600, and that's the first time we're seeing that since early March. 629 infections were reported this Friday, and that is the third highest daily figure recorded in Korea. And 600 of those were local transmissions, with 29 being imported cases. And it was just last week when we had concerns of surging numbers as they hit the 500s, but now we're heading into the weekend with over 600 infections. And with that, the country has a total number of 36,332 infections, and also 7 fatalities were reported in the past day, the death toll standing at 536. Now, this recent trend in daily cases is raising the question on whether current prevention efforts are sufficient in bringing the numbers down. That's why Prime Minister Chung Se-kyun also addressed this concern at a briefing earlier today.
The number of COVID-19 cases, which dipped slightly as of late, is again rising, meaning the crisis is still ongoing. We will monitor the situation until the weekend and decide whether we need to take additional measures.
And that meaning officials are reviewing whether social distancing measures will have to be upgraded by another notch in the capital region, which has been under level 2 for some 10 days now. But no clear signs have been observed of better figures in the past days and weeks. In fact, if we take a look at our map now, the capital of Seoul recorded its highest daily figure of 295 infections. And that is also why there are questions on whether this part of the nation, especially Seoul, has to be put under the highest of the social distancing measures. But Seoul's acting mayor said earlier today that level 3 is the last card the capital will use in a desperately dangerous situation, and that in regards of economic woes the country could be facing. We also have 160 cases today in Gyeonggi-do province, 17 in Incheon, and also a concern down in Busan with 31 new infections.
Right, so meanwhile, on the international front, as I mentioned earlier, a grim milestone with regard to the death toll.
Yes, Sunny, the deadly virus has killed over 1.5 million people around the world, less than a year since its outbreak in late December 2019. And if you put that number into perspective, that's around the population of Daejeon, the 5th largest city here in Korea. And the average daily death toll also stands at over 10,000 in the past week. If you take a look at the latest figures, already in the past 24 hours as of noon Korea time, we have over 12,500 new fatalities. And if we take a look at the countries with the highest death tolls, we have the U.S. at over 282,000, followed by Brazil, India, Mexico, and the UK. The U.S. meanwhile had some 2,800 deaths in just a day recently, and also almost 1,000 new cases were reported in Italy, which we see on our next map here. Italy with a total of 1.6 million. And in the meantime, we have Iran, which has just surpassed the 1 million mark in total cases. And South Africa also over 800,000 cases have been reported there. And those are the updates I have for now. I'll be back with more next week. Back to you, Sunny.
All right, so I'll see you on Monday. Back on the local front, nearly 500,000 students took the National College entrance examination yesterday with extra precautions in place to curb a potential outbreak. I have our Kim Sung-yeon here in the studio with details on that. Welcome, Sung-yeon.
Good afternoon, Sunny.
Right, so how did things go yesterday?
Right, Sunny, for the first time ever, yesterday students did take their so-called Corona Sunung, or Corona CSAT, the College Scholastic Ability Test. Now, unlike previous years, the overall atmosphere in front of these exam sites was very calm without the usual cheering going on. The Seoul city government had banned cheering outside test centers in Seoul and urged parents not to wait outside. Hence, many students hugged their family members quietly before walking into their classrooms, and parents turned back without waiting. During breaks, test takers were asked to refrain from gathering and talking, and they were also required to bring a packed lunch to eat at their desks. Water coolers were not installed at test centers, so students had to bring their own water. Students were also asked to dress appropriately to stay warm, as classrooms were ventilated at the end of each session. Now, exams were held at a record number of classrooms due to the need to maintain social distance between the test takers, and there were more proctors and other staff on duty as well. 24 examinees were allowed at each classroom instead of the usual 28, and a partition was installed on each desk as an added measure as well.
Right. Now, Song-Yeon, I hear that those who also came into contact with COVID-19 were able to take the test.
Right. So students who had either been infected with coronavirus or they were in self-isolation, they also did take the exam. But obviously, they were separated and took their exams at special exam sites nationwide. Now, this year, more than 426,000 high school seniors, graduates, and others took the college scholastic ability test, which included 35 coronavirus patients, 404 people in self-quarantine as of Tuesday, according to the Education Ministry. Hospital beds had been set up to accommodate 205 COVID-19 patients and special exam sites for up to 3,775 people in self-isolation. Now, after the test began yesterday morning, President of Korea Institute for Curriculum and Evaluation, Sung Ki-sun, announced the number of separate test-taking sites for students either ill or in quarantine.
There are 29 hospitals or care centers set in place for test takers with the coronavirus, and 113 test sites in place for those in self-quarantine.
Right, Song-Yeon, I hear a test proctor also tested positive on the eve of the examination, leading to a major reshuffle.
Right, so I'm sure you did hear about the news on the night before the exam. So on Wednesday night in the central city of Daejeon, a high school teacher who had planned to serve as a proctor tested positive with COVID-19. After the proctor, who is a high school teacher in his 30s, tested positive on Wednesday night, all other proctors who had come into contact with him were removed from their exam duties as well. Now, this led the local education office to replace 31 proctors in total, including the patient. 4 of the patient's family members have all tested positive as well, along with another fellow high school teacher, for a total of 6 cases directly related to this patient. Meanwhile, another CSAT proctor who was actually present at an exam site in the city of Jeonju tested positive with COVID-19 yesterday, and contact tracing efforts are now underway.
Also, Song-Yeon, a few applicants chose not to take the test given the resurgence.
Right. For the first time ever, some people actually forfeited taking the exam at all because they were worried about catching the coronavirus. Their main concern was being put in self-isolation, which would not allow them to go through the other steps that are required after the CSAT exams to get into college. Those that do not necessarily need a CSAT score are among those who have decided not to take the exam at all. As for the universities, they're preparing to conduct online interviews and adopting new methods in their admissions process. Now, complicating matters, there have also been new outbreaks at college campuses nationwide, including Korea University in Seoul and Donga University in Busan just this week, and that's adding to the worries faced by college applicants who have to visit universities in person to write their essay tests or walk in for an interview with the admissions office. Now, Education Minister Yoo Eun-hye announced in a briefing earlier today that for the next 2 weeks until December 17th, the Education Ministry, along with the Korea Disease Control and Prevention Agency, will closely monitor the situation for any signs of an outbreak stemming from the CSAT exams.
The Ministry of Education, together with the Korea Disease Control and Prevention Agency, is working to minimize worries over the possible spread of COVID-19 from the CSAT exams by speedily responding to all possible contingencies and carrying out intensive monitoring for 2 weeks until December 17th.
Right, given the 2-week incubation period of the virus, we will have to wait and see a few more days to see how things do play out. But the education authorities and the test takers themselves certainly did their best to hold the exams in the safest manner possible.
All right, Song-Yeon, thank you for that. I'll see you again next week.
Thank you. See you next week.
Right, the age-old wisdom is that prevention is better than cure. Accordingly, social distancing, that is apart from social distancing and personal hygiene practices, there has been high demand for cleaning and disinfecting services to fight the pandemic. I have Chun Song-cho up next. Hello, Song-cho.
Good afternoon, Sunny.
Now, Song-cho, I hear you're joining a team of professionals today who seek to keep our environment coronavirus-free.
Yes, I'm at a gym in Bucheon, which is just southwest of Seoul, because I wanted to show you guys the rigorous disinfection procedure they have here. Well, we know that COVID-19 spreads through respiratory droplets. And when people are exercising and breathing heavily, they tend to expel more droplets in the air. And also with strict social distancing guidelines these days, fitness centers and gyms across the nation have really stepped up their effort for virus control. So let's have a look how the disinfection procedure looks like. All right, so as you can see, there are all these specialists, a couple of them, wearing in PPE from head to toe. They're wearing the full body suits, they're wearing masks, and they're spraying disinfectant into the air to sterilize all these equipment. And the solution they use is called hypochlorous acid solution, which is very effective at killing coronavirus within just 30 seconds. But you might have noticed that there's still a few people working out in this gym. That's because the solution is regarded harmless to a human body. So let's ask a few questions to one of the specialists. 안녕하세요.
안녕하세요.
혹시 방역하실 때 어떤 점을 가장 신경 쓰시나요?
네, 문 손잡이나 기구 손잡이 같은 사람 손이 많이 닿는 데를 중점적으로 하고 있습니다.
감사합니다. All right, so he said that he usually focuses on any surfaces or objects that people frequently touch most, such as handles or doorknobs in the facility. So, and then they repeat this routine on a regular basis. This is just a small part of the intensive cleaning regimen they practice in the facility. And the cost of running businesses like here has really gone up because they had to overhaul the entire operations in order to implement all kinds of infection control measures. So hopefully we'll be able to flatten the curve of new infections soon. And in the meantime, let's focus on what we can do on an individual basis, which is wearing masks, keeping social distancing guidelines, and then washing our hands as frequently as possible. This has been Chun Song-cho reporting live from Bucheon, and back to you, Sunny, in the studio.
All right, Song-cho, thank you. And a big thank you to all those involved in the campaign to keep the virus at bay. Meanwhile, to our viewers here, we also apologize for the slight mishap in the lip sync error, I think, in the connection with Song-cho earlier. All right, it's time now for the fourth installment in our coverage of Korea's free economic zones. I have Peter Bint here in the studio, as always. Good to have you with us again, Peter.
Good to be here, Sunny.
Right, so I hear you're focusing on the Chungbuk free economic zone today.
Yeah, known as CB Fez, right? So it's established this industrial cluster in the city of Cheongju in Chungcheongbuk-do province. And because the province is located in the central region of Korea, it is easily accessible from most parts of the country and has emerged as a major urban center. You can in fact drive to CB Fez from Seoul in just 30 minutes and 10 minutes if you're traveling there from Sejong, where many government agencies are located. It can be reached in 2 hours or so from pretty much most cities and provinces in the peninsula, thanks to its central geographic location and Korea's advanced transportation network. In addition, 61 large cities with a population of more than 1 million can be reached in under 3.5 hours by air, so it is possible for a business traveller to take a day trip within the area that is home to 2.5 billion people. Since CB Fez and Korea as a whole, for that matter, are close in proximity to major cities in China and Japan, it may be of great interest to businesses that want to tap into the Asian market.
Right. Yeah, despite its strategic location, Peter, securing investors has been tough for the area because of the pandemic.
Yeah, that's true. So last year was a bumper year for them. They made much more money than in 2018. In fact, the 111 tenant firms nearly doubled their figures and business activity was very lively. However, due to COVID-19, many tenant businesses have faced some serious challenges, compounded by the difficulties in attracting especially new investors due to the travel restrictions.
Right. But I hear efforts to lure investors have not all been in vain, though.
It's not all doom and gloom, no. Yeah, in spite of COVID-19, firms including Cheongju Osong, BL&H and Amazon K, as well as Rafa Rofe, signed investment deals worth a combined $91.6 million, recognizing the future growth potential of CB Fairs, and in particular the Osong area in Cheongju, and they plan to build new manufacturing plants in the Osong Biopolis district. BL&H, for instance, are a Canadian investment company, and they're going to build a manufacturing plant by investing $60 million over 5 years to produce non-toxic disinfectants using some overseas technology. And Amazon K is set to invest $27 million to complete a distribution center by 2025. Rafa Rofe, a cosmetics startup, will invest $4.5 million over the next 6 years to build a new factory in hopes of becoming the premier cosmetics firm in the Chungcheongbuk-do province. So once they set up their operations, they're expected to create more than 150 new jobs.
It's quite a number. Peter, why did these three companies choose to invest in this particular zone?
Well, for Amazon K, it's the central location as a distribution hub, right? It is situated there and can get to all parts of the peninsula with its excellent transportation network. BL&H, which plans to build a pharmaceutical plant, and Rafa Rofe, which is planning to build a cosmetics plant, decided to invest in CB Fairs in the hopes of seeing the benefits of synergy generated from other firms and agencies that are in close proximity.
I see. Meanwhile, how are authorities at the Chungbuk Free Economic Zone seeking to tackle the challenges brought on by the pandemic?
Well, they're mainly promoting investment in the biotechnology industry at the moment. The strategy is to further nurture that industry and turn the COVID-19 crisis into a new opportunity. So according to the Bank of Korea, the biohealth sector is one of only a handful of industries that are expected to post strong growth figures amid COVID-19. So let's take a closer look at the current state of the biotech business in CB Fairs, which is now broadening its focus with eyes on becoming a global biotech industry cluster. CB Fairs is looking to attract foreign investments by developing a total of 4 districts, namely the Osong High-Tech Medical Complex, Osong Biopolis, Cheongju Aeropolis District 1, and Cheongju Aeropolis District 2. CB Fairs is looking to take a leap forward in the biotech industry by integrating several specialized clusters. They include the Osong Bioscience Complex, Korea's only national biotech industrial complex, the Osong High-Tech Medical Complex, a global medical research cluster, and Osong Biopolis, which has a concentration of local and foreign BT and IT businesses.
주변에 도내에 있는 바이오 제약 학교들이 다 경제저해 우영 안에 밀집돼 있고, 또 주변으로 식약처 질병관리본부청이 있고, 또 옆으로 가게 되면은 이와 유사한 연구기관들이 대거 밀집해 있습니다.
The Ministry of Food and Drug Safety, the Korea Disease Control and Prevention Agency, state medical research institutes, and pharmaceutical research support centers have set up R&D centers in CB Fairs, creating an optimal environment where biotech R&D, licensing and production all happens in one place.
Right, Peter, so what is the merit of setting up a biotech cluster?
Well, currently there are lots of biotech-related higher learning institutes already, 120 research centres and more than 60 pharmaceutical and medical equipment firms based in Osong Bio Valley. So it is hoped that these biotech firms and institutions can create an industrial ecosystem that promotes mutual growth through technology sharing and the free exchange of ideas. In addition, 6 government health agencies, such as the Ministry of Food and Drug Safety, Korea Disease Control and Prevention Agency, and the Korea National Institute of Health, have moved into the free economic zone to support licensing and permits. So all of this provides a one-stop shop for the entire R&D process, from clinical trials to licensing, manufacturing and distribution, by providing everything from A to Z in regards to biotech infrastructure.
I believe the Moon administration itself has also spoken of intentions to bolster Korea's biohealth industry.
Yeah, they want it to be one of the pillars of the Korean economy moving forward. And so once it does become that, it intends to promote the Korean biotechnology and also Korea's successful COVID-19 containment measures to the world by supporting the development of COVID-19 treatments and vaccines and certifying Korea's disease control measures as an international standard. For this purpose, regulatory reforms will be carried out and a regulatory sandbox will be created to better allow businesses to create new markets and localize production of raw materials and equipment, establish a training center for biotech workers, and create a more sophisticated biotech cluster. So hopefully these efforts could help create an ecosystem that is conducive to innovation in the biotech sector. CB Fairs is expected to play a big role in advancing Korean biotechnology, with the zone already boasting a well-established biotech cluster.
Peter, what are the business prospects for biotech firms in the zone at the moment?
Well, they have exported more than $10 billion. We're talking about the pharmaceutical and medical equipment sector, and that's for the first time ever. So we visited one of the biotech companies in the zone that's been posting steady growth, despite the challenges posed by COVID-19. Let's learn more. Prestige Biologics is a contract manufacturing organization that provides specialized services to pharmaceutical companies. Making use of its advanced technology, the company is involved in every step of the manufacturing process of biopharmaceutical firms.
유방암 항체 신약 그리고 췌장암을 타겟으로 하는 신약 그리고 자가 면역 질환에 대한 항체를 주로 하고 있습니다.
As a CDMO entity for global pharmaceutical companies, Prestige Biologics has obtained GMP certification, an international standard for pharmaceutical manufacturing and quality controls from the Ministry of Food and Drug Safety, and is now preparing to export to Europe.
최첨단 항체의약품 제조 시설을 갖추고 있으며 글로벌 GMP 인증을 눈앞에 두고 있고, 특히 싱가포르의 프레스티지 바이오 파마와의 전략적 제휴를 통해 글로벌 바이오 CDMO 회사로 발돋움하고 있습니다.
So why did Prestige Biologics choose CB Fairs as a business partner?
세제 혜택도 받는 것과 더불어서 각종 정보를 쉽게 접할 수 있고, 유사한 회사 간에 협업을 쉽게 이루어지게 할 수 있음으로써 가장 좋은 장점이 되겠습니다.
So what benefits do companies that invest in the zone look to secure?
Well, some of the benefits include providing grants that amount to more than 10% of an investment, financing at low interest rates, and various tax benefits. In addition, government employees will provide one-stop administrative services from land purchases to factory operations. For more details regarding the benefits on offer, the Chungbuk Free Economic Zone Authority is on hand at any time for free consultations.
And Peter, this particular zone is also supporting local startups, I understand.
Yeah, that's right. So Korean startups that are interested in setting up shop here will be given all the support they need, which will come from the Corporate Academic Convergence Headquarters, the Medical Innovation Foundation, and other supporting agencies. So these entities will provide R&D support, some funding, startup consultation, and office space, creating ideal conditions for startups to grow. And many startups are growing and making further progress by purchasing additional land and building new factories.
Right. Aside from the biotech industry, is there another industry that the zone is looking to nurture, Peter?
Yes, the aviation industry is a big one in the area. It's being groomed as a mainstay for CB Fez. In October, Cheongju Aeropolis District 1 signed an MOU with 3 helicopter maintenance firms, and Cheongju Aeropolis District 2 also signed an MOU with 16 companies in the aviation business. And moving forward, Cheongju Aeropolis District will partner up with Cheongju International Airport to form a high-tech industrial cluster, which will comprise of logistics, aircraft parts, and aircraft maintenance.
All right, Peter, as always, thank you very much for the detailed coverage and see you next week.
Pleasure to be here. Thank you.
이와 같은 인구 구조 변화는 생산 가능 인구의 감소, 잠재 성장률의 하락, 부양 부담의 증가 등 경제 사회 전반에 심대한 영향을 미치는 구조적인 위험 요인으로서
Korea has been grappling with falling birth rates and an aging population for a while now, but the pandemic is looking to push the country closer to the brink of a full-blown demographic crisis. For more on the related repercussions, I have Professor Yang Jung-suk from Catholic University of Korea. Welcome back, Professor Yang. And I also have Professor Kim Jin-ho from Korea University. Pleasure to have you with us, Professor Kim.
Thank you.
Right, Professor Yang, pundits claim Korea is edging closer to a demographic cliff on the back of falling birth rates. How severe is this phenomenon?
Okay, well, the total fertility rate for the third quarter was calculated to be 0.84%. What does that mean? Well, total fertility rate is about, you could think of it as average birth per woman. And it's been below 1.0 for third year in a row. Now, the replacement rate, if you want to maintain the population more or less current as it is currently, is about 2.1%. You may think it's 2.0, but it's because there's some accidents and such, you need slightly more than 2.0, but we're not even achieving half that. Now, if you compare it to other countries, in 2018, the lowest among OECD, Korea was the lowest total fertility rate among OECD countries. The next lowest is Italy, but they're above 1. They're 1.3. The average OECD fertility rate is 1.6. So it's, in a sense, it's a worldwide problem, the low fertility rate, but Korea is hit extra hard than other countries because we're not even making 1.0.
I see. And Professor Kim, amid these circumstances, there are concerns that the pandemic will further aggravate Korea's already grim demographic portrait. Do you agree?
Yeah, it seems pretty obvious that COVID-19 would worsen the trend of low fertility. We have a couple concrete numbers supporting this idea. For example, according to the enrollment data for a voucher scheme for pregnant women, as of August, there is about 10% decrease in enrollment. So if things actually continue at this rate, we expect to have about 50,000 fewer babies born in this country next year. So this number suggests that Korea's fertility rate of 0.84 for the past consecutive two quarters. So it's likely to even go further because this rate only captures the pre-COVID-19 fertility level. And yes, it's not only us, but it's actually the most of developed countries would experience similar fertility decline. So a global expert is really projecting that there will be about 1.3% decrease in fertility rate on average among most developed countries for the next year.
I see. Professor Kim, in the early days of the pandemic, there had been speculations of a potential baby boom with many people confined to their homes, but the opposite has been true, meaning a tangible drop in birth rates. How do you explain this reality?
Yeah, a baby boom as a side effect of the devastating pandemic sounds kind of nice, but I think it's probably too good to be true. What is more likely is that people would delay or forego having children because of coronavirus. Although some data show that people tend to engage in more sexual activity than usual, probably because of all the extra time at home with not much thing to do, but than usual, especially because of the extra time. But we do not really have necessary ingredients for baby boom. So these ingredients include like more people partnering or reduced contraceptive use among couple, but we're not really seeing evidence of these things. Also, all the uncertainty about economic outlook and safety concerned, would rather suggest that even established happy married couple is likely to delay their having children. Moreover, additional forced time with loved ones actually tends to strain rather than nurture relationship, which is also consistent with an increase in reported cases of domestic violence around the world since COVID-19 outbreak. So I would say all signs point to fewer babies being born as a result of COVID-19, not more.
That's quite unfortunate. Professor Yang, do you see the economic hardships brought on by the pandemic as negatively affecting the population?
Yes, but we have to talk about, I think, the long-term trends first. The long-term trend is, first of all, there's more women who are working in the workforce. So the cost of having children actually is going up, not just the explicit cost of education, of finding childcare specialists and so on, but also the opportunity cost, because the more time you spend raising kids, the more income you're giving up. Now, I haven't seen a study like this in Korea, but in a study done in the United States, one study says that if you delay having a child for 1 year, your lifetime income can go up as much as 10% for a young woman. So it may make economic sense for them to delay having children as long as possible. And then if they wait too long, then they may just miss out opportunities of having children completely. And then there's the Korean factor, the long-term Korean factor that comes up on top of that, which is that raising kids in Korea is unusually hands-on. You have to advise your children on what kind of schools, what kind of hagwons they go to. You have to attend a lot of teacher meetings. You have to attend a lot of these personal meetings with people who are taking care of your children. So that is in addition to what typical women in other countries face. And then on top of that is the coronavirus problem. If you have, say, a negative hit on your income, well, you don't have enough money to raise your kids, so you're going to delay or forego having children altogether. And then another problem with the coronavirus is that you're scared to go to hospitals. And, well, if you want to have a baby, you'll probably want to go to a hospital in the first place, but well, if there's a chance of you catching a coronavirus when you're going to a hospital, then you may delay your decision.
Right. Now, for a broader look at the relationship between the pandemic and fertility, I have Professor Arnstein Osove from Bocconi University over in Italy live on the line. Welcome, Professor Osove.
Thank you. Thank you.
Professor, you jointly conducted a study that concluded fertility will fall in high-income nations in the short term after the pandemic. Would you care to elaborate on that, please?
Yeah, I think that as my colleagues are suggesting here, I think globally, certainly in the high-income countries, we're going to see a fertility decline. And we already see some evidence of that. There has been some recent studies in the United States suggesting that the fertility rate is going to go down. Also, here in Italy, there are some studies suggesting that the fertility rate is going to go down as a part of the pandemic. Now, so why would that happen? Well, my colleagues alluded to it. One is economic, as we understand. Having children is an exceedingly expensive venture, and with the pandemic, there is a lot of job loss. People are losing their income, so that's going to have an impact on people's decision to have children. But the other thing is also the broader social consequence here. A lot of people feel a higher uncertainty as a result of the pandemic. They don't, and one of the things that's important for having children is that you need stability, and you need to be able to predict how your future is going to pan out, because it's a long-term investment, right? So as long as there is more uncertainty about the future, that's going to be not so good for fertility.
Right. Professor Osve, I understand the Spanish flu reportedly resulted in a temporary drop in fertility before a remarkable recovery. Why will this reality not be possible post-COVID-19?
Yeah, so there is a lot of evidence that pandemics or let's say other natural disasters are associated with a drop in fertility rates. And the Spanish flu is an example of that. Clearly, Spanish flu was a bit more serious than the COVID, despite the fact that the COVID feels obviously very serious for us. But one of the issues about the Spanish flu is that it also coincided with the end of the First World War. So you entered a period with a lot of optimism and rebuilding of our societies. So there, and part of that, higher fertility ensued. Now, in this case, I think we are not so sure to what extent there's going to be a rebound in fertility. One reason is that I think that the pandemic here is bringing about some structural changes in terms of occupations. There is going to be winners and losers. And the winners, good for them, of course, but I'm not so sure they're going to have more children as a result of it. But those people who work in occupations that are truly affected by the COVID, and these occupations might be affected long term, there, I think we're going to see a sustained decline in fertility.
I see. Professor, what would you say are the implications of your findings in light of the prolonged fight against the pandemic?
Yeah, again, as my colleagues are suggesting here, the issue here long term is that low fertility is going to have an impact on our aging societies. So we live longer, life expectancy is going up, yet at the same time fertility seems to decline. So you're going to enter into a process where you have a relatively less young productive people compared to the number of old people that you have. So that's going to have an impact on the sustainability of social security, pension systems, and so on. And in the long run, it might have an impact on the potential for economic prosperity. So that is the long-term consequences of this low fertility.
All right, Professor Osve, thank you very much for making the time to join us live with your thoughts at this hour. Right, Professor Kim, the Health Ministry here in Korea, meanwhile, has shared a rather rosy outlook, claiming that the birth rate will rebound after the pandemic. What is the reasoning behind this rosy forecast?
Yeah, the ministry has suggested that social capital and social trust accumulated while Korea handling the pandemic quite successfully might translate into a potential driver of a rebound in fertility rate. I think a fertility rate can actually rebound a bit once coronavirus is gone, but for a very different reason. A potential increase might have something to do with tempo effect, where some foregone births during the pandemic may be picked up after coronavirus is gone. But I doubt that the potential rebound will be really significant enough to be detected, given even more stronger signs pointing toward lower fertility in the future. For example, declining marriage rates. So like a recent statistics show that in August alone, about 15,000 couples were married, which is 18% decline in marriage rate compared to the same month last year. I believe this has such a strong implication, especially for Korea's fertility in the future, because More than 98% of births are born within marriage, and more than 80% are born within 5 years of marriage. So the COVID-19 induced decline in marriage rate would naturally mean a further decrease in fertility rate here in Korea.
I see. Professor Yang, generally speaking, what are the economic repercussions of a shrinking population?
Okay, if we look at it from the broadest point of view, there's three factors which contribute to economic growth. First is increase in labor force, which is directly tied to the fertility rate, though with a time lag. And then second, how much capital stock, how much equipment, how much factories you have. That depends on investment, and then how much productivity growth you have. How efficiently are you using your labor and capital? Now, for Korea, if you look at it in the long term, the productivity increase hasn't really played that much of a role in Korean growth. What played the most role is the labor growth because of the high birth rate in 60s, 70s, and maybe up to even 1980s, and then people coming out of the agricultural workforce into manufacturing and service workforce. That was mostly in 60s and 70s. And then in the 80s and 90s, very high investment, which increased the capital stock. But now it seems that the investment seems to be somewhat slowing, not just after the coronavirus, but even before then. And the fertility rate is dropping, so that means less and less labor force in the future. So since productivity growth didn't play that much of a part, these two factors mean that economic growth rate will slow down, and that's probably why we've seen a fall of growth rate in the last 5 to 8 years. Now, having said that, if we can get a productivity growth that can replace the lower fertility increase, the lower increase in labor force, we can probably maintain a fairly good growth rate. But the problem is, if you want to have a larger growth in productivity, we have to have a lot of reforms, and the Korean economy or Korean politics doesn't seem really set up for that. Now, another potential problem is that a lot of economists do argue that if you have lesser young people in the population, then there's less dynamic activities. So that, again, contributes to lower productivity. That's a bit more controversial. My personal feeling is that what matters is creativity, whether you're old or you're young. But then another problem is, again, because of a lot of Korean traditions, a lot of Korean legal and regulatory structure, sometimes it doesn't encourage a lot of creativity in economic activities.
I see. Professor Kim, what then are the social repercussions of population decline and population aging?
Maybe ever shrinking like a school-age population in Korea, maybe one of the greatest social impacts of a population decline. Because of a population decline, schools are being closed. So Ministry of Education is projecting that there will be about 120,000 fewer high school graduates than the total number of college openings in 2024. So a nationwide reform to reduce the number of college openings is underway. And also there will also be an ongoing college reform to really accommodate a changing demographic landscape in Korea. And rural areas suffer the sharpest population drops because of both low fertility and continuing migration into larger cities, especially Seoul and Gyeonggi areas. So the increased risks of local extinction or underdevelopment of local areas might be also a social consequence of a population decline.
Right. Professor Yang, there are some pundits who claim that a smaller global population will prove to be of much benefit to the environment in the long term. What are your thoughts on this? Okay, well, the larger population do put in a lot of pressure on the environment, but that can be controlled if you have a green-friendly economy. So I don't think that's as serious a problem. But if we don't make the switch to the green economy, then obviously there will be more pressure on the environment. But it depends on how much reforms, how much changes are people willing to go through to achieve this goal. And as I mentioned, if we have enough productivity growth, if we have enough innovation, then a lower population equilibrium is a workable
equilibrium. But again, problem is, do we have enough capacity to make those changes? And also, there will be a lot of changes in industry, not just because we're moving from the current industries to green industries, but also because we're going to focus on industries which focus on younger people to industries which focus on older people, like healthcare, homes for the older people, medical services, and so on. We also have to make that switch, but Korean economy lately, it hasn't been very good at making such big changes, except maybe in the area of IT. So that's a concern. We have to go through a lot of not only changes in laws and regulations, but also changes in attitudes and willingness to be flexible. Problem is, do we have that? And that's going to be the big question.
I see. I suppose that's something we'll have to work on in the near future then. All right, Professor Young, as always, thank you for your thoughts. And Professor Kim, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of this week's coverage of COVID-19. The daily tally here in Korea has taken on an alarming trend, so do seek to do your part to keep infection numbers within medical capacity by avoiding unnecessary gatherings and by wearing a face mask. Have a safe weekend.